So your handouts, handout in the learning module, take a look at these, and these are good practices, all from your book anyway. So go through these beats. You could see, well, you have to say here, you probably did this already, but just to see where the beat is coming from, right? Is it sinus? Like this one's sinus. This one happens to be junctional. It's the ugly one, right? This one is atrial, right? And this one is a clear ventricular and sinus, even though the PR interval doesn't look right. And junctional, all these, just go through and make sure you get those, which I think you do. And here's the ones from your book. So take a look at the beat and remember the heart rate. Assume that all of these are 6-second strips. So here's all your sinus rhythms, right? This is sinus rhythm, but what would you call this one at 40 beats per minute?
Bradycardia.
Right now. Thanks, Danielle. Bradycardia. And then this one here, it's regular. It's got 3, 4, 5, 6, 7, 70 beats per minute. So what would we call this one? Normal PR interval, normal QRS.
Normal sinus rhythm.
Hell yeah. Let's take a look at this one. Normal 2, 3, 4, 5, 6, 7, 8, 9, 10. This is still normal sinus rhythm. Everybody agree? It's 100. So call it normal. What do you think? It's normal. So this one, the next one down is P waves over there. Anybody count this? It's over 150 beats per minute. Somebody went crazy. You can see the P wave, right? So what is this?
Sinus tachycardia.
Yeah, that's sinus tachy. Good. And this one obviously is P on T. You see it? I see the P on T. So this again is sinus tachy cardia. Ignore the upside down T wave for now. And what do you have here? 30 beats per minute, normal PR interval. And it's regular. So again, this is bradycardia, sinus bradycardia. And this one, P wave, normal QRS, every beat, 1-to-1 ratio. The problem is here, you have an irregular rhythm. It's regular in its repeating, but it's an irregular rhythm because of the slowdown. So what do we call this one?
Sinus arrhythmia.
Yeah. Sinus arrhythmia, very good. So the sinus ones you got down. This one looks regular. Let's look at the PQRS. PQRS. Now we got these weird P waves. And they change every time, 30, 40, 50, 60, 70, 80 beats per minute. So what do we call this one? Well, where's the rhythm starting from, first of all?
The atria.
Yeah, it's atrial. So what do we call this one? It's kind of a specialized one, I guess.
Is it a wandering atria pacemaker?
Yep, a WAP. That's a WAP. It's a WAP, says Elmer Fudd. Wandering atrial pacemaker because the heart rate is less than 100 beats per minute. What if it was above 100 beats per minute? That would be tachycardia, right? Or multifocal atrial tachycardia, or MAT. Now this one has a shitload of P waves in front of a normal QRS, but it's regular. So what do we call this one with that sore tooth pattern?
Atrial flutter.
That's flutter. My internet is unstable. Can't write on top of that. Flutter. Now this one is completely irregularly irregular. There is some type of quivering in that baseline. So there is the atrial movement and depolarization, massive circuit reentry or massive multiple foci. So what do we call this irregular rhythm? It's definitely not ventricular. It's not junctional because there is P waves, sort of, or attempting P waves. So what do we call this one?
Is this supposed to be AFib?
This is AFib, yeah. Look at the line. It's sometimes it kind of goes off baseline, but this is not a straight line because if you see this, that's ventricular, or possibly, if this is normal, that would be junctional. So this one has normal QRSs and has the P wave. Just mute your mics, please. How about this one? P waves, you see any P waves?
No.
No, but they're all the same and it's regular. And what's the heart rate? 40 beats per minute. So what do we call this one?
Idioventricular rhythm. I mean, junctional.
You just call it junctional. You're right. And what's the inherent cadence of the AV node? 40 to 60, right? Everybody okay with that? That's junctional, no P wave. Junctional rhythm. What about this one? This looks junctional too, but we're gonna have to do the heart rate. It's regular. What is this for? This is 80 beats per minute. So what is this one?
Accelerated
Yeah,
jump.
this is accelerated junctional rhythm. This one has a short PR interval. So this is junctional too. And the heart rate is above 100. So what do we call this one? Tachy, right? Everybody okay? Junctional tachycardia, right? Did I miss something?
Oh, that's right.
Okay. Thank you. Oh, this looks like a mess here. This is a problem. So no P wave. Does this QRSs look normal to you? Just mute your mics for a second. Thanks. Does these QRSs look normal? Then I'll stop talking. Go ahead. Are they normal?
No.
Okay. So what rhythm is this?
Ventricular?
Yeah, idioventricular rhythm. Between 20 and 40 now is the inherent cadence. Cadence. I like the name Cadence. If I had a cat, I'd name it Cadence. If I had a dog, I'd name it Spike, like the pacemaker Spike. Spike and Cadence. I'm gonna go rescue some dogs and cats today. All right, let's move on. Unstable professor. So now we have, again, the next one down, you have erratic wide QRSs. No P wave, erratic. These are not normal. What's the heart rate? 60? So what do we call this? Accelerated idioventricular rhythm. Accelerated idioventricular rhythm. Am I correct there?
Yes.
Okay. So this is an the top one is idioventricular rhythm. And these are all ventricular, by the way, just so this is right from your book. So of course you'd have to know them out of sequence sometimes. So this is ventricular here too. And what's the heart rate? 1, 2, 3, 4, 5, 6, 7, 8. So this again is accelerated idioventricular rhythm. This one you should know right by looking at it. This is the one EKG I'll let you look at and call it. And this is like 150.
Tachycardia?
What is it?
Ventricular tachycardia.
Yes, please know this one. This is VTAC, right? The next one is also VTAC, but it has this weird, we're having a party ribbon look, which is a long QT causing this. So what do we call this one?
The torsinostic points? Or
Beside the point. So that's a special one, just like the Wolf Parkinson White is a special one you should know. Okay, now we're in trouble. We couldn't control this, and then we wind up with this or the one on the bottom. So what's this one on top? And they kind of are, they look like QRS complexes, but it's completely irregular. Like everything above this, except for torsade de point, was kind of regular. What do we call this one down here? This one, sorry.
coarse ventricular.
Course, right? Ventricular fib. So this one on the bottom would be fine. Ventricular fib. And the next one would be, that's asystole or cardiac arrest.
Asystole.
Yeah. Sorry. Asystole. So this kind of goes along with your book right here in this PowerPoint. And you could do some premature contractions here. I don't know if this pacemaker spikes on any of these, but you could see, let's do a couple of these. The one on top, it's okay. It's okay. It's okay. It's okay. It's okay. And then all of a sudden you have this. And look at the P wave. So this is what? It's a premature contraction, but what cadence? Or what source? Sorry.
Atrial?
Premature atrial contraction. Normal, quick, pops up there. So this would be a premature junctional contraction. And this one, 3 normals, 4, 5, and then you have a ventricular. So this would be a premature ventricular contraction, PVC. This one's a little tricky here. Take a look at this one. It's got normal. And then you have this huge T wave. And then you have a QRS that's relatively normal. So because the P wave is in the T, this is a premature atrial contraction. And you have that escape where you have a little bit of a delay afterwards. So the next one is a junctional escape beat. So there was no P wave, there was a delay, and then you have a junctional beat right here. So that's an escape beat. Really don't ask these often on the exams. And this one is a premature atrial contraction with, again, that delay. So sometimes this can cause a problem, like if you have this rhythm in your heart. Now this one is normal PVC, normal PVC, normal PVC, followed by normal PVC. And this is bigeminy. So the bottom one is bigeminy, which we mentioned before. This is this is trigeminy, normal PVC. And then it follows. So that's trigeminy. And the bottom one is quadrigeminy. Excuse me. Okay, let's practice these. Pacemaker spikes. Again, you have to recognize that on EKG. These are not QRSs, right? Sometimes they look like that. So which one is this? Please tell me. I'll give you 5 seconds. What is this pacemaker?
Atrial pacemaker.
Yeah, fixed or demand?
Fixed.
Yeah, it's fixed. You have to say fixed. Yeah. So the next one, excuse me, is a fixed ventricular. And what do you call this one? It's coming every time, but 2 spikes per beat. So what do we call that?
Dual? Fixed.
Right, dual chamber pacemaker, and it's fixed. So fixed, dual chamber pacemaker. How about this one? We have, these are QRSs with no spikes, and then you have 2 with spikes. So what do we call this one?
Demand ventricular?
Exactly, demand ventricular pacemaker. So be able to recognize those spikes. So these are kind of sloppy because they're drawn in. So sometimes they look like, especially if it was tachycardia, it would look like, sometimes it would look like an actual QRS, you have to be careful with that. You should be real familiar with this. So here we have, what do we call this up here? In both. What do we call that? QRSs are normal, but you can't see a P wave. So what do we call that before we do the carotid massage?
Supraventricular.
Yeah, that's all SVT, both of them. But now we do the rubby-dubby of the baroreceptors. And what would you call this? It's tachycardia still, but what would you call that?
Atrial tachycardia?
Yeah, I would call that atrial, because that's not a sexy P wave there. What about this one below it?
Junctional.
I agree. Excellent. Junctional. And it's still tachycardia, no matter how you slice it. Now, this one, you're not rubby-dubbing anybody's neck or ass or anything. This is just ventricular fib, right? I'm sorry, ventricular tachycardia. Are we good? So that's not supraventricular tachycardia because it's the ventricles. Because SVT means the above the ventricles, meaning it could be sinus, it could be atrial, or it could be junctional. So the bottom one's clearly not supraventricular. It's ventricular. That's a ventricular rhythm, and it's tachycardia. Whew. What's going on here? PQRS, PQRS, PQRS. So what is that one? At 50 beats per minute, I guess, yeah. What do you call that rhythm?
Sinus bradycardia.
It's sinus bradycardia, yeah, you're right. Okay, let's look at this one. P is normal, QRS is normal, but this one looks something's wrong with what here?
Your interval's messed
Yes,
up.
it's prolonged. So what do we call this?
First degree.
AV block, right? This is AV block. This is critical right here. Okay. This one we have a P, QRST, a P, QRST, PQRST, P, oops, PQRST, and looks like the PR interval is progressively getting longer every third second beat. And there's a drop QRS. So what do we call this one?
Mobitz 2 Wanky block. Or
Second
Mobitz
degree
1
heart block. Yeah, second degree AV block, Mobitz type 1. Wanky back, that's right. That's wanky back. The next one is second degree. So we'll look at, there's a missed QRS, there's a missed QRS, there's a missed QRS. Oh shit, there's a lot of missed QRSs here. This is not good. So this is second degree Mobitz type 2, right? Everybody good?
Yeah.
Critical, this is critical that you know this. Okay, the next one, there's P waves, they're all over the place. You do have missed QRSs, prolonged PR interval. This is a P wave right here. This is all wacky. Missed QRS here because this is a P wave, but you have wide QRSs. So what is this one? Yeah, what is this one? It's third degree AV block, right? Or complete heart block. Yeah. What do we have here?
Bundle branch block.
Yeah, we have R prime wave every time too, right? Every time. It's regular. So this is, if this was in V1, what would it be?
Right bundle branch block.
P wave in the PR interval is normal, you see that?
Professor, I have a question
You
about.
kind of have to be careful with this one. Sorry, I'll get to you. Like when you look at this, right? This particular picture, like this is not a spike. You know, this is a just separating the leads, the 12 leads, you see? That's not a spike, you understand?
Yeah.
Yeah, that's pretty crazy, right? That's pretty crazy. So lead 2 is a mess here, right? This is not what it's supposed to look like. AVR is negative, but that is not looking good. And you have bundle branch blocks here, V5. So this would be, well, this is both sides, this is bad. Okay, so V2, V5, I see bundle branch blocks. Not good. Not good. I'm sorry, question?
Oh yeah, I had a question. So going to like the bundle branch block. So on an exam, to tell the difference between right and left, we have to like in this case, this EKG strip that you're showing us right now, it doesn't say like where it is, like either V1 or V5. So if that's the case on an exam, you would like let us know that that strip is from one of those.
Yeah, I would let you know.
Okay.
Yeah,
Okay.
V1 or V6. Typically, though, I kind of was wrong on this. Typically, The left bundle branch blocks look more like these. But you don't have to worry about that. You
Mhm.
don't have to worry about that. So that's a good question. Yeah.